Your GI prescribed antibiotics and said nothing about what they do to a gut that already has Crohn's. So here's what actually happens and what I do about it. Hi, I'm Kate, and today we're talking about antibiotics, your microbiome, and a practical mitigation protocol built for Crohn's. Because the gap between "it'll be fine" and the fear-driven supplement content online is exactly where you need clear, calm information. After my husband's third surgery, he was given quite a few courses of antibiotics, and we did not realize what would follow in terms of the health of his gut. During my son's Crohn diagnosis as well, antibiotics were also in the mix, and we started to notice a pattern: antibiotics and other symptoms that may have occurred. And I had a client question me once after a flagell course, and it made me realize nobody explains this to people. And this is what the research shows. People with Crohn's disease have measurably lower microbiome diversity than healthy controls. A 2019 review in Gut found diversity can be reduced by 25 to 50% in active disease. Now, when you add antibiotics, that diversity gets compressed further. Great, right? And in a Crohn's gut, the species most vulnerable are the short-chain fatty acid producers, the bacteria that make butyrate, which is one of the primary fuels for your intestinal lining. Another yay. So that loss is real. It is documented, and it is also something you can actively support your gut through without catastrophizing and definitely without ignoring it. So firstly, you need to understand what actually is at stake. So there's three specific things. Diversity collapses, there's SCFA producer loss, and opportunistic overgrowth. They're the things. So mitigation needs to be targeted. It cannot just be, take this probiotic, you'll be fine, because it cannot be genetic. So the most important thing to do is the timing of your probiotics. Probiotics taken too close to an antibiotic dose, well, they're simply killed. You're wasting time and money. There's a 2-hour spacing rule, and this single timing detail is the most commonly missed step. You need to choose strains that have evidence, because not all probiotics are created equal. The other thing is to make sure you research this and you are accessing the probiotics that have the strongest trial data for your specific situation, because that supplement shelf can feel overwhelming. What you need to do is also feed the survivors with a very strong fiber strategy. During and after a course, specific fermentable fibers act as prebiotics that selectively support SCFA producers trying to re-establish. But fiber type and amount matters enormously for a Crohn's gut that may be inflamed. So also know your post-course warning signs. There is a clear set of symptoms after finishing antibiotics that warrant going back to your GI rather than waiting. So what you need to think about is the timing, the frequency, is there blood in your stool, etc. Once you finish your antibiotics, if these symptoms occur, then you need to contact your GI straight away. Always remember, my husband is now 20 years flare-free, and that post-surgical antibiotic period was navigated as part of a longer picture. Now, we need to be realistic, and that expectation has to be managed. Your microbiome recovery after antibiotics, it takes weeks to months, not a few days. And that is okay because you're supporting it. So it feels different to go into an antibiotic course with a plan rather than just anxiety or fingers crossed, hoping for the best. So if this gave you a clearer picture of what to actually do next time antibiotics are on the table, share it with someone in your Crohn's community. I'll see you in the next video. Have a beautiful day.